Hello, aspirants. NEET PG exam is nearing, and you know the date of exam is in the March 2023. So this webinar will help you how you can crack NEET PG with Neuros. So we are here to help you make most of this time that you have in hand. Today's webinar will give you some critical insights that will help you crack NEET PG. So what should be your last 6 month strategy for NEET PG? First thing that you have to understand the syllabus and exam pattern. It means that you have to see the pattern of questions, kind of questions which are asked for the last 5 years. And for that, obviously, you have to undergo those questions, you have to solve those questions. Then you know that nowadays, previously there were 300 questions in NEET PG, and nowadays there are 200 questions, and you have to solve these 200 questions in 3.5 hours, right? So you have to brush up the exam pattern and subject weightage. You must be knowing that majority of subjects are asked from pre-final year and final year subjects, but there is integration of the subjects with first and second prof subjects. Means you will find that there will be integration of subjects between surgery, between anatomy, surgery, radiology, sometimes surgery, anatomy, as well as radiology. Means the first thing, you should not leave even a single subject. All 19 subjects are important, right? So if you see the exam pattern, you can notice that how many questions are asked from which particular subject. If you see from medicine, surgery, approximately 20-25 questions are asked. From PSM, from path, pharma, micro, from ops and gynae and PSM, very high yield subjects. So you should mainly focus on these subjects, but you should not ignore any subject because there is integration. Second important thing, whenever we are studying, we should be having a realistic timetable. When I'm talking about realistic timetable means you should be having enough breaks in between studies, and you should sit at least for 2 hours in one stretch, and the break duration should not be more than 30 minutes. And whenever you are making a timetable, you should be having the timetable for next day. So whenever we are going to sleep, we are having a timetable that tomorrow I'm going to study this particular subject, these topics, I'm going to revise this particular topic from this, and I have to solve so many questions. Targets. You know that revision is the key to success. And how we can revise Neuros. Neuros revision bootcamp is the first thing that comes to mind. Why? Because top most educators are there and they are going to teach you effectively for 21 days, in which you can revise all subjects effectively. And whatever the important topics which were asked previously in the previous 5 years, 6 years, those topics will be discussed. Simultaneously, you can interact with faculties face to face and you can discuss your doubts also. Second important thing, whenever we are preparing, we have to go for the mock test. Some of the students are having this kind of hesitation in the beginning that, sir, if I'm going for the mock test, my scores are not good. And because of that, I'm a bit depressed. See, don't bother about the score in the beginning. First, just for the practice, go through the mock test. In the beginning, at least one mock test for the first 15 days. And later, after 1 to 2 months, there should be at least one mock test you have to go for every week, at least. Later, when only 1 or 2 months are left, you can solve two mock tests every week. So this should be your strategy. Now, how to enhance the productivity? So we discussed that we have to plan our day in advance. If you don't have that kind of plan, then what are the topics you are supposed to study tomorrow? Obviously, you're going to waste the time. And see how we have to study smartly. You have to divide your day into active learning and passive learning. What is active learning? In active learning, we are going to study or we are going to read the new fact and we have to revise the thing. That is the part of active learning. In the second half of the day, when you feel tired, you feel a bit exhausted, take rest and then solve MCQs. Minimum at this point of time, you should solve minimum 100 MCQs and later you should increase it to at least 200 questions per day. We have to use smart techniques to memorize and increase retention. How? You have seen that lots of students are using mnemonics. Even our faculty are the dream team is going to tell you the mnemonics, that how you can increase the productivity, how you can learn, or how you can memorize the difficult tables, difficult topics. Similarly, you have to use spaced repetition for revision also. And whenever we are studying, what is the problem? See, sometimes obviously we are having some kind of depression, mild depression is there. Sometimes stress is there. Let me tell you a simple principle is there. Studies are inversely proportional to stress. So if you are studying effectively, the day when you are going to utilize, obviously you are going to think that yes, I'm having lesser stress. So how to decrease your stress? Keep studying. And whenever we are studying, I have seen some of students are using social media also during study. So that is a big distraction. You should eliminate distraction, avoid using social media, study and practice mindfully, take enough breaks between two sessions, and ideally it is said that you should sit for 2 hours, take break of 15 to 20 minutes, that's coffee break or tea break. And if it's a lunch break, it should be 1 hour or 1 hour, 1.5 hours. Adequate sleep is mandatory. Minimum you have to sleep for 6 to 8 hours, because if you're not going to sleep properly, obviously your brain is not going to work. And the absorption of your brain is going to decrease if you're not going to sleep properly. So basic things: plan your day, study smart, avoid distractions, use repetition and mnemonics for revision, and stay focused, eliminate distraction. I would like to invite Dr. Siraj, and he will continue this presentation. Dr. Siraj.
Okay, thank you very much, sir, for such a beautiful insight. And I'll be taking just 10 to 15 minutes for giving my input that revising 19 subjects definitely in this short period of time is not very easy. So what are the different things that we can utilize? What are the different tips that we can utilize in doing your revision effectively? Do remember that whenever you whenever you are done with your studies, because your examination is just around 5 minutes, 5 months from now, so this is the right time for you already to start your GTs, right? So I think we can take the this is the slide, right? Okay. So you start your GTs already as soon as you are done with 6 to 7 hour, I think. 6 to 7 subject, as soon as you are done, you start your GTs. Now most of the students I have seen, they start they wait for their 19 subject to finish and then they try to start the GT. That is not a very correct approach according to me, that I feel. As soon as you are done with 7 subjects, do the GT. Then students will be asking, sir, what if I perform poor in the other subject? What about the rest of the 12, 13 subject? That's absolutely fine. In that 12 to 13 subject that you have not done yet, you will at least know that what kind of questions are being asked. So first and foremost, you have to start your GT, the sooner the better. So minimum, I'll be telling you at least 6 to 7 subjects should be done. Not only that, I'll be telling you that you have to start working on the regular basis. It's not that you will be starting and you'll be doing a couple of GTs and then you stop. No, you have to complete this. You have to do this on the regular basis. In the GTs, you'll find it out. Okay, where are you lacking? Find it out. Which subject is troubling you? Is it, let's say, anatomy, or is it my subject like pharmacology is troubling you? Ask yourself, put your hand on the heart, ask yourself which subject is troubling you. Once you have this idea that which subject is troubling you, definitely you have identified half of the problem. Now what you have to do is to target those problems, right? So if you already know that, okay, your pharma is weak or your anatomy is weak or your, let's say, micro is weak, you will be working towards that. Whenever something is troubling you, like as big as anatomy or pharmacology, try to do the fragmentation technique. Divide them into multiple small fragments. Don't read the pharmacology or whatever your weak subject is for the entire day. Just give 45 minutes to 50 minutes in a day, and continue doing the rest of the syllabus that you have on the regular basis. For this one, remember guys, time management, as Pritesh was also telling, is very, very important. You have to plan your time ahead of time. Before you wake up, before you hold your coffee mug, you should hold your notes. There should be notes in your hand. So how will you do that? Because before, prior to sleep only, you have to decide that what are you going to do? Are you going to do the MCQs, or are you going to, let's say, revise the notes? So keep that on your table. Wherever you are studying, keep that on the table, keep that ready, and then go up to sleep. Like before going off to sleep, if you're switching on the AC, likewise, make sure that's a ritual, that you're keeping that notes, that when I get up, I'll hold this, then I'll hold the coffee mug or the next thing that I wanted to do. That is how you can do. In the time management, within the shortest period of time, revising 19 subject definitely is not easy. So we oftentimes we talk about that, use smart study technique, and most of the students are going like nuts that, okay, what is a smart study technique? Tell me, I want to use smart study technique, I want to be smart. So there are many ways. I mean, my version of smart study technique can be different, it can vary from any one of you here. So what I would be telling, that whenever you are attending one class, this is an approach that I have used. I can tell you the same. Whenever you are attending that class, most of the time I have seen students, they try to revise line by line, and they attend 8-hour class, and they dedicate around 4 to 5 hour time just in going through those notes. My approach will be, since the time is lesser, attend the class, go back to MCQs. Whatever you have learned in the 5-6 hours through the day, or let's say 7-8 hours in the day, go back to MCQs. Do a retrograde analysis, that in the entire day that you have read, what all question are you able to solve easily? Whatever question that you are making mistake, if there is if something is going wrong, refer back to your notes. Right? Create a deficiency of information in your neurons. If there will be deficiency of information in your neurons will be hungry to take that new information. Okay, I have made that mistake, I should take that, I should take this particular topic very seriously. And definitely once you read at that point of time, I have seen that that information, when you make mistake and then you learn, right, we tend to remember that for a longer period of time. So that would be one of the approach for smart study technique. Another approach that I always tell to the students, that always try to keep your syllabus simple. Keep it simple. Most of the times, students they turn out to be a collector of the notes, or collector of the MCQs. So don't be a notes collector or MCQ collector. Make it very, very simple. Whatever notes that you are reading, go ahead, do that notes. Keep one source of notes, keep one source of MCQs. Do that. MCQ again, sorry for that, MCQ you can use as much as you can for the practice. When it comes to MCQ, the most important thing that I'll be telling to all of you guys, that don't keep the MCQs that I'll be doing MCQs every Sunday or every Tuesday, or Wednesday is the birthday of my girlfriend, so I'll be doing MCQs every Wednesday. Don't do that. It should be on the regular basis. It should be habitual. Make sure that 20 to 25% of the time on the regular basis should be dedicated to MCQs. So ask yourself by the end of the day, have you spent around 2.5 hours in the MCQs or not? And on which topic are you planning to do MCQs? The same topic that you have read throughout the day. I mean, if all of you guys are preparing, so what you are doing, you're reading, doing the MCQs. So if you utilize these of the simple approaches, I don't think it's gonna be very, very difficult for all of you guys, right? So sometime I have seen that students are reading, let's say they're reading gynae, which sir is here, and all your favorite subjects, your gynae, you'll be reading gynae from one notes, and some of your friends are also approaching you, and then they ask you a question which you don't know from the same topic that you have read. So that will create again a negativity inside you. So if someone, if whatever you are reading, just follow your notes, follow your MCQs, and don't get distracted by the information, don't get distracted by the question that has been asked to discourage you. Follow that, follow the notes that you have taken, and make sure that you don't be a notes collector or a paper collector. Do remember that previous year papers are going to be helpful here. Your PYQs, don't underestimate. The questions are not repeated, we know that. And we have been telling this continuously, questions are not repeated. If there are 200 questions, if you're lucky, 5 to 6 questions may be repeated. That is also maybe. But topics, they're often been repeated. I think all the respected sirs here, they will agree with me that the frequently we are analyzing the question papers, and the topics are very frequently being repeated. So whatever question that has been asked in the past, go through the options of those and why that particular option is wrong. Now try to know that. Because imagine if I am the faculty, those who have asked to make a question paper. I'll take my example, and I have given one question paper this year. Now there is some other authorities telling me that, okay, make a question paper again on this topic. And if I have been doing this from let's say past 10 years, I'm already having a question bank. So what I will do, I'll immediately go open my system and I'll see what all question that I have made, We'll try to do some of the changes. We'll try to send it across. This is what we have seen. The topics are same, usually on the same topic. They used to do a little bit of change in the modification of the language. Sometimes the clinical based question they have turned out to be into image based question, or sometimes image based question has been turned out to be a clinical based question. The topics are often the same, remember guys. And your MCQs are actually designed in the same way, right? Can we have the next slide please? Whatever MCQs that is coming, they are designed in the way that that are usually asked in your mock test. Remember, so once you continue giving the mock test after 6 to 7 subjects, definitely you will be on the right track. Try to learn from your mock test, that what all mistakes that you have done, and don't underestimate those. According to my experience that I have seen, whatever score that a student usually gets in the mock test in the last 2 months of the preparation, whatever score they are getting, most of the time, not 100%, but around 80 to 90% of the time, the same score is also replicated in the actual examination as well. So please do not underestimate the mock test that you have, because your mock tests are curated by the highly experienced faculty that we have here, and they will be using the same technique like any other faculty will be using for giving your actual test. All right. And all of you must have been posted in your clinical scenario as well in your different departments. So whatever information that you have learned from there, that is another thing that you should keep in mind, because most of the time student does not take it seriously. They'll simply go and they'll try to put attendance and they'll run from there. No, we have seen that whatever clinical information that you have learned while rotating in the different department, those topics, those simple topics are also being asked in the examination. And all the students, those who have done it seriously, they have done a wonderful job in the examination. We have seen that. And once again, for all of you guys, continue doing your mock test, continue doing the revision on the regular basis, and stay positive, take care of your health. And we'll pass this on to Sir Vij sir. Over to you. Thank you very much. Sir, you're not audible.
Well, thanks, Dr. Siraj and Dr. Pritesh. Well said, as usual. Very informative information and a very informative discussion. And good afternoon, Dr. Kaushal. Great to have all of you together discussing this. Now, upfront, before I discuss what's there on the slide, I would like to highlight what Dr. Siraj said, that, the topics are always repeated, the questions are not. Because once you know these topics well, then you can go ahead and catch any question which is coming on those topics. It's always a rule that if you're doing gynecology, you have to do PCOS and you have to do CS cervix. If you've not done these two, these topics are going to come in the exams. So whichever MCQ comes, then you can go back to the theory about these MCQs and do these topics so well that whatever MCQ in and out of that topic comes, you can always finish it off in no time. But if you have a problem of being a note collector or a MCQ collector, like Siraj was saying, then you are in big trouble, because all these MCQs are made by people like you and me. And we are recalling these MCQs. We never recall them properly. We never recall the choices properly. And you guys actually spend a lot of time discussing amongst each one of you, your WhatsApps and your discussion time. The time which you should be actually spending reading is gone in contradicting what one answer has been given by one of your teachers. If I say that somebody has to do active management of third shift labor from 4 centimeters, you're always dissecting that by so many other teachers, because it's come in some guideline, it has come in some book, and it has come in some recommendation from American College or from the Royal College. Are you wasting your time? Why are you becoming a note collector or a MCQ collector? You're actually splitting your heads over that one MCQ so many times that you're cutting off the time which you can read so many other topics. So please, the guidelines which are American, Royal College, Australian, New Zealand, and South African, these are none of your businesses. Please, your guidelines are the 19 educators who are taking your classes in Neuros, and these are the people who have read all the guidelines for you. Now, if there is something major, a new guideline has come, we will tell you those. You don't have to come and tell me, sir, the Americans have said this. Aren't we going to change this definition? No, please. If it is in Williams obstetrics, I'm going to ask you to follow that. You're not going to come and teach me the guideline, please, because these guidelines change every 15 minutes. If you're going to read guidelines, then you're wasting your time immensely. So please, If there is a major information like, okay, now you can do MTPs till 24 weeks of gestation. Fine, I'm telling you that. That has changed and you as it is know them. Something major like that happens. Now we are discussing about changing the plans of management of something. And I am actually working on diabetes in my hospital right now. And my director, myself, we're doing so many papers. You can put my name and see. But I'm not telling you any of that in my lectures. We are not. Because what is core basic? The core basics don't change for a PG entrance or MCA entrance. So if you have your core basics fine, then you pass this exam in flying colors. And if you're wasting your time in reading information from multiple sources, you are a confused person. So yes, I thoroughly agree with what Dr. Siraj said, that please channelize your energies and please, I would want you to think of studying more in less time. Always keep yourself focused. If you're not focused into your reading, then you had it. Because you have limited time. See, everybody thinks that 3-4 months left for the exam. But in these 3-4 months, you're going to discuss in terms of time wasted on your personal problems, time wasted on your loved ones who are not well, your relatives, time utilized for taking care of people who require your attention. There are going to be times when you're going to have a marriage. So actually you have less time than what you're thinking. The effective reading time in a day is not as much as you think. So please utilize the time in a way that Dr. Pritesh was saying, that when you're sitting on the chair, read for 1.5 to 2 hours. And that time, my consultation time, doctor, he's a surgeon. I mean, he can stand for 7 hours and do a surgery. My longest surgery is 2 hours. So my sitting time is, let's say, 1 hour to 1 hour and 30 minutes. So in that 1 hour, I'm not looking left or right. In that 1 hour, I'm reading so hard that if somebody calls me, I'm not listening to him. If there is a good movie going on, if there's a good match going on and Kohli is hitting his century after all, I'm not watching that. My 1 hour, that 1 hour, I'm so dedicated that if there is no current, I've got my phone light, I've got a candle to take care of my reading. In that time, I'm not getting disturbed at all. That 1 hour, I'm going to grind it. Then I'm going to get up and take that break, with Tesh was saying. That I'm going to read for now 1 hour, 15 minutes. I'm going to roam around. I'm going to revise in my head. I'm going to call my friend and discuss with him. Ki, yaar, maine ye padha tha. Did you read this? Is it the same? Tell him what you read. He tells you what he's read, and then you get a good discussion. So study more in less time in that 1 hour. Now give multiple such 1 hour sessions in a day. You must give something like 6 or maybe 7 such sessions in a day. I'm telling you, you'll put in more amount of reading in that 1 hour sessions than sitting non-stop for 8 hours. In non-stop for 8 hours, you get distracted a lot. I've done that. All of us have, sometimes started reading at 9 in the night and we got up at 6 o'clock from the chair. And then when you see the number of hours you put and the amount you've read, totally mismatched. It's a total mismatch. So please go by this, study more in less time. And remember, when we are doing these sessions with you, come prepared. We are doing 19 sessions with you. Please don't just come and sit in the class because sir is going to teach us whole of gynae in these 2 days. Please, it's not going to happen. I'm going to revise with you. So please read and come. Make this session count. We are going to do the MCQs which have come in the last few years. And if these MCQs, if you know well with us, you revise, get the doubts cleared with us. Make this session count, because if you have this trouble solving sessions with us, then you know what is not asked in the choices which you're reading in the MCQs. Again, it comes to the same, that the MCQs are recalled by people like you and me, and we never know the 4 choices properly. So if you want to know the choices, there is no better way to go and write the exam, isn't it? So when you write the exam, in the exam, you get the MCQs and the language in such a clear way that the questions, the options just pop out. The right option just pops out in front of you because you've read your theory well. So when you see these MCQs, these 19 subjects when you're reading, please read all the topics properly. And when you come for the sessions, make these sessions count by asking doubts to the doctor rather than just sitting passively and taking notes. Okay, we will give an impetus on all of this. We will trouble you. We will not let you sit passively and just write notes. We will ask you. We'll trouble you in the corner of the class. The guys sitting in the back, please be ready. I'm going to ask those guys first. Okay, and yes, to make sure that these sessions count, we're getting you the best teachers we feel which are present in this country right now. The 19 subjects by the best teachers. And studying in a classroom environment is always better than doing the online classes. You know very well that for some time we were not having the live classes, and our app did very well to help you in those times when there were no live classes. But yes, when you supplement the app with the live class, things change dramatically. Drastic improvement in your performance, and listening to a teacher and discussing with him is always better than listening to the person on the app. Yes, the apps are always good. The rapid revision programs which we have, they're going to give you the right amount of knowledge in short amount of time. But then the live classrooms, nothing comes close to that. And we as teachers, the kind of energy you people give us when we're taking a class, the number of different kind of students who are there. You're North Indians, South Indians, you're East Indians, and you have some of you like to talk in a different way. Some of you have read a lot, and you have some very critical, aspects of the topic to be discussed, and that gives us the energy to go and read and come tomorrow and tell you more about those topics. And some of you are like, sir, we are asking a very simple doubt. I hope it doesn't trouble you. Please ask a simple doubt, because if you not asked us the simple doubt, you're going to mark that wrong answer which you're holding in your brain. MCQ exam is like what is there in the back of your head that suddenly just pops out in your mind. So when you have you think it's a stupid doubt, please never think that. Just ask. Somebody really asked me, sir, I heard the menstrual loss is something like 1 liter per month. I said, what? For a moment, I was surprised. And then I said, yes, if you have that in your mind, then you're probably going to not mark 30 to 50 ml for the whole menstrual cycle. So if there is something stupid in your head, don't trouble me in the class, but then do keep me asking the doubts which are always hitting you. Okay. And what I feel is that when you're doing this preparation, how you amplify your preparations. Look, there is no end point. There are 19 subjects to be done. And if any one of you said that I did my whole microbiology completely, you're a liar. Nobody can say that I've read my whole of pharmacology completely. So how do you amplify yourself in your preparations? You understand what has to be read in this time. Now, let me give you that very simple guru mantra here, that whatever doctors you're following, you could be following anybody for gynae, you could be following anybody for surgery or pharmacology or anatomy. It's your wish. But since you're discussing this with us and you're coming to Neuros for the revision, the best method is the notes given by these teachers. You spent a lot of time reading these notes, making your note. You have sat through 50, 55 hours of gynae live classes, or 80, 90 hours of my app, or you have gone through 120 hours or 150 hours of surgery. And after all the effort you have put, forget what me and Pritesh have done. You should give importance to the effort you have put in, guys. You have read all of that. And 1 week before the exam, you pick up a new book because your senior says, "Arey yaar, that guy's notes are better than this guy. And this is an easy way out to your miserable life. Read this small book and you'll finish." Whatever efforts we gave in to teach you in these hours of discussion, you just spoiled it in 1 week. You have corrupted yourself at the right moment before the exam. Please don't do that. Please believe us. 95% of what I say is correct. I'm not perfect. Definitely not the best teacher anywhere. I will not claim that. But yes, I am teaching you because I have the experience of teaching for 20 years. So I must understand what you people are doing and how you people have read and how you people suffer when you're reading. So since I understand that, maybe I'm slightly more equipped to teach you how to read. Contents to hum log ka sabka same hai yaar. All teachers know the same things. Maybe I'm slightly better equipped to tell you that don't fool yourselves in that 1 week before the exam. Do not buy a new book now. Do not get into new discussions. You come and discuss with us. You got your doubts sorted. You have your notes. So how do you finally know that you have completed your course? You have completed your course once you've done the 19 notes. You've done your 19 notes given by these 19 teachers, whoever they are. And then you have come and discussed 19 days with. After that, if you have time, I'm sure you don't have time. But if you still have time left after doing the 19 subjects notes, 19 subjects Neuros revision, you still have time. The same 19 teachers are available on YouTube, free for you guys. All of us have done all the MCQs for the last 4 years, free for you. It's there on the Prepladder websites, on the Prepladder YouTube channels, and you can just go ahead and read all the MCQs done by us. I must be having around 350 or 400 maybe MCQs across all the the INI-CET and the NEET and the MCI. Please go ahead and read IMCQs. So the same teacher who's taught you the same teacher who's given you a revision, and the same teacher is available on the YouTube to teach you the same way you're used to. And after that, I'm claiming that I'm teaching you 95% correct. Okay, 5% I could be wrong. And that's enough for you to crack. If you get 95% in all the 19 subjects, I guess you've cracked it, right? So with all this information, I hope you people have a good channelized mind and a well formatted assessment of your own preparation, and then come to the Neuros revision sessions with us. And I'm looking forward to. I'm seriously excited to grill you guys in person so that we have a very informative and educated sessions. Okay. All right. All the best. I pass on to Dr. Kaushal. Go ahead, sir.
Thanks a lot, Dr. Vij, Dr. Sriraj, Dr. Pritesh. It has been wonderful insights coming from you to the students. And as I understand, live sessions are definitely, the human touch is there. We are with you. And that human touch actually gives us so much of energy and so much of efficiency. I have seen myself personally, like if I'm recording a session and if I'm in a class live sitting, like in front of the students, then it is totally different scenario. And my efficiency goes to ultimate level, altogether different level. And we are capable of delivering more, and specifically, the new topics, the recent topics, because while we teach, of course, most of the teaching is at spinal level because we already have some data information with us, but then it is at the cerebral level also. Because we continuously, while we are teaching, keep on thinking about which questions have come recently and what should be focusing or teaching the students and what should be withholding. Because we obviously cannot teach everything, and we have to withhold some information. We have to understand that what kind of questions might be appearing. It is kind of a instincts basically. So live classes are always much better than actually the passive kind of recording what we do. And as far as the preparation goes, like you have very limited time now, maybe 5 months in hand. If we are talking about the NEET PG exam, what I say is a famous line which I speak all the time is you have to know few topics very well. You have to know almost everything about few topics and few things about every topic. So you cannot be focusing upon all the things. And how do you decide like where to focus or defocus? And there is only one thing which can help you: the previous year questions. So advice is last 5 years, but then if it is possible, increase the sphere of activity to 10 years. Don't go beyond 10 years because then the things have drastically changed. So I cannot say that anatomy has changed, but the pattern of asking questions, they keep changing. And previous year questions are the access. They keep you on track. If you are not practicing those MCQs, then you may be going off track because content is enormous. You can get lost into the information. So to be on the track, your access is basically those previous year questions. Now, Neuros, when we are talking about Neuros, obviously like anatomy, I'm having 2 days. What can I do in those 2 days? Obviously, for us, anatomy was 1.5 years. For you people, I believe it is 1 year. It is, how will I justify my stand when I tell you that we'll be taking care of anatomy in 2 days? But then imagine that your exam is after a week or after 10 days. Then obviously, how much time are you going to spend on anatomy? Cannot be more than a day or maybe less than a day. So in that sense, what happens is, like, of course, then you have to finish your anatomy within half a day. So that is the kind of approach we are having when we are coming to in front of you taking Neuros classes. And in that scenario, of course, the latest topics which we are thinking that might be coming in the recent exams we'll be focusing upon. But then we will, and it is not that I'm there to teach you anatomy as such. What we do is we try to teach you how to handle yourself, how to handle the subject, how to handle the MCQs. If there is MCQ, you should always know there is a famous saying that you should have some 6 friends with you. Always keep on asking, what is the answer? Why that is the answer? Why others are not the answer? When they will become the answer? So is asking these questions, why, when, to yourself, that strategy is always important. Practicing MCQs is one thing. Like our esteemed faculty were telling, it is not the MCQs which are repeated, it is the topic which are repeated. And how do you know which topic is being repeated? By practicing those MCQs. Now, as I see the slide, the Lucknow session, which we have planned, the seats are already sold out, which is a good thing, because if the auditorium is full with a lot of students, it's always an interactive thing, and we feel energized. A house full auditorium is always exciting for the students also. And when you are sitting with your friends, with the people with whom you are actually going to compete, that is something which gives you an energy. Competition creates quality. That's what we say. So sitting among those people, and if when you find that they are answering something and which you may be withholding, or may not be so forthcoming, that gives you an edge, rather than sitting alone in your room and just watching those videos. So the classroom, the live sessions are always much, much better. And as I find, the information which we are having here is October 10, we are starting, and all the 19 subjects will be taken care of. 21 days we are spending. And of course, 19 top educators, as we say, who have been in the system for long. Dr. Viz already mentioned 20 years. And in a way, like we started together, in fact. So for me, maybe it is 21 years. But we have that experience. We have seen, we have watched this pattern of exams changing. Like recently, for last 2-3 years, they have started giving you cadaveric images, just so strange, giving you HND stain slides, which we are unable to find, decipher in the class room setup, and they're giving it on the computer, and expect you to identify and then answer questions. So, but we train you accordingly. And then Kolkata, as we talk about Kolkata, I came to know that it is 1,000 students who can sit. And if we have 1,000 students sitting in front of us, just imagine the level of energy which we will be having. It is always human touch, the interaction. We derive energy from each other. So almost, I think 600 seats are already booked in Kolkata as well. And we look forward to meet you. And it's always enjoyable for us. Like Dr. Viz were telling, you are welcome to ask us those questions. Any question, the basics. In fact, we make more mistakes in those basics. And just take it from me, even the toppers, they do make mistakes. Only thing is that we have to basically minimize those mistakes. It is not that we are going to be perfect. Nobody is perfect. Dr. Viz is telling that maybe I'm reaching excellence level 30, 95%. I cannot be 100%. Nobody is 100%. We are not gods, and even gods are not perfect. So doesn't matter. 95%, if you are getting, I think 70% score itself is so fantastic that you will be in the top 100. So the thing is, we have to focus and defocus. Defocus from the things which are not necessary. And as it comes to live classes, I think it is real-time adjustment we keep doing. And I am very hopeful when we are interacting, when you are asking us questions, things will reach altogether a different level. So Kolkata seats, limited slots available, as the slide is showing. October 10, again, we are starting. I think that the ending time is a bit different, 2 days difference there otherwise. So Kolkata people, I have been coming to Kolkata for a very long time. It's been almost 14 to 15 years, I believe. And Kolkata people, even Lucknow, like recently, I haven't been coming to Lucknow, but lovely people, lovely students. So we are looking forward to have a very interactive, lively, and productive sessions. Dr. Pritesh is a master, you can say, born at his own हुनर इसको कहते हैं. वैसे ही डॉक्टर सिराज हैं. फार्मा में आपको कोई कॉन्फिडेंस की कोई जरूरत अगर आपको कोई कमी महसूस होती है, ही विल बी देयर टू बूस्ट योर कॉन्फिडेंस. एंड डॉक्टर वेज का तो मैं क्या कहूँ कि ही इज अ क्लिनिशियन एंड ही हैज सच करिश्मा, you know, to explain things. Like it's I have seen him teaching at some places, and he is totally different person. Means what you find him right now, he is totally different, altogether different level. So we are all blessed people, I believe. It's all blessing of God, and we do whatever we are supposed to do, and try to achieve the maximum, and we push ourselves, and that is what, you know, a teacher when stand in front of you, he is basically an inspiration for you. You are not only learning subject from him, you're learning the ways of life from him. The dedication, the hard work, the the energy which you feel, that should be transferred to you. So with that, I think we should bring things to an end here for the time being. And it's been a real pleasure, Dr. Pritesh, Dr. Siraj, Dr. Viz. The interaction was insightful. I believe the students will definitely benefit from all what we have spoken here. So take care and see you soon at those two destinations, that is Lucknow and Kolkata. Right.
It's really nice, and thank you so much for all your remarks, and best wishes to everybody here, all my friends, and let's do a great session with all these students. It'll be exciting to see all of you.
Thank you very much, sir. And I'm sure the students are going to enjoy. We are also excited for the same, that attending such a huge crowd of 500 to 1000 and putting everything in, let's say, our subject, like my subject, pharmacology, in one day. How am I going to do? You guys will be surprised as well. We'll be having a workbook based, revision. Likewise, I believe our other faculties also will be having their plan. So in one day, what we can do, you'll be going through the entire topics. That is my plan. And also in that topic only, I'll be covering the past 5 to 6 year question that has been asked. We'll be covering that as well, and the insights behind that as well. Thank you very much, sirs, and thank you very much to all our learners.
Good luck, guys. We are eagerly waiting for all of you. Thank you very much.
And if you are having any questions, kindly ask us.
Yes, I think it's time to ask a question.
Yes. So we'll be entertaining your queries.
There are a lot of queries to open the center in South Hyderabad, Chennai. They all are calling you, sir.
Yeah, I understand.
Some of the students are having this kind of question that, sir, I'm not able to revise. Okay, you have prepared. So this revision bootcamp is for you people only. You come and we are going to complete the entire syllabus. There will be 19 faculties and the things will be completed in 21 days. Rapid revision is there if somebody is not able to come, somebody is from far-flung area. So for you people, rapid revision is there. But if you can attend these revision camps, come for the Neuros revision bootcamp. Definitely, it is going to help you a lot. And whenever you are sitting with 500 plus people, your energy level is totally different. Totally different. See, your energy level is directly proportional to number of students sitting in the class. So if it's more than 500, obviously our energy level is also maximum and your energy level is also maximum. So come, actually it would be an enjoyable session. It's just not a teaching. It's just kind of a conference, two-way conference in which we can interact together. We can take up your doubts and simultaneously we can learn both ways.
I think there are some students they're asking whether it's an online or offline. It's an offline class to all our learners. And just as Vij sir was also mentioning, that come prepared and make sure that you'll be learning a lot of information once you also have read and you're coming to the classes. It's an offline class, guys.
Right. Just saw all the comments. Thanks for your remarks, all of you students who have been writing on the chat. And God bless you all. Thanks. And looking forward seriously. Any particular doubts, if you have, you can ask us now. This is a live session. We'll be in a hall full of students, and teachers will be there, and we'll be discussing things live. Don't have any doubts on that.
So students are asking about the notes. Of course, you'll be given the notes, and notes are very beautifully framed. And I myself feel proud that the Prepladder team has done wonders, putting those notes in a very lucid and colorful manner. And notes will be definitely given to you, and they're like high-yield facts basically. And quickly you can revise your notes. So that is one chat question I have found here. And sir, what about those going for counseling? Counseling, we can have other session where we can talk about the counseling. At the moment, we are talking about this Neuros live classes. Please come to Nasik. Yeah. Prepladder will be planning, I think there will be some more sessions, I believe. For the time being, even Kerala, they are asking. Dr. Siraj is already mentioning that people want us in South as well. So we are only in North and West at the moment. But definitely, like, as a teacher, it is a privilege we want to reach as many students as possible. And we are blessed actually in that sense that we are having that, you people provide us the opportunity, and we should be actually utilizing this opportunity to the maximum. And we want you to become very good doctors. I think that is the ultimate purpose we have. Of course, getting a PG seat is a barrier to be crossed. But what we want is you become a good human and become a good physician or a surgeon. So that's what we actually strive for. And let's just go through some more chat queries if they are there.
So I think sir, questions are similar. So
Okay.
thank you very much, all of you, for this kind of interactive session. And we would love to see you all, or most of you, at our revision boot camps in Kolkata and Lucknow. So guys, we are ending this session. Thank you very much.
Thank you, sir.
Guys, do well.